Male pattern baldness is very common. I struggle with it. Hi, I'm Dr. John Hong, board certified in internal medicine. Male pattern baldness is actually less common in Asian Americans and African Americans compared to Caucasian Americans. The prevalence of male pattern baldness in Caucasian men is 30% by age 30, 50% by age 50, and 80% by age 70. It's a slow, insidious process of the hair becoming thinner and falling out. It usually starts at the front and the temples or the top of the head, and you can't say how fast it's going to be or what the extent it's going to be. But it is not a rapid loss of hair. It is not associated with rash or any itching. So why does hair fall out in men? Genetics, genetics, genes, genes, genes. We've all heard the old wives' tale. A guy's hair is based on their mother's father. That's sort of true, but it's not. So it's really the total number of guys in your family that have male pattern baldness will affect your risk about getting bald. In particular, your dad. If your dad is bald, you're more likely to be bald just as well. So why is this? Androgens, because androgens bind to the hair follicle and it shortens the growth phase of the hair, and before you know it, you start getting peach fuzz because the hair starts getting thinner and shorter, and then before you know it, you see a mole on your scalp that you never saw before. So medicine that treats this conversion of testosterone to the active form, DHT, are prostate medications such as Finasteride and Dutasteride. Yes, a prostate medication, it shows that not all side effects are bad effects. So what it does is that in guys, it can actually help hair follicles regrow, or it can help it actually just slow down the process of it falling out. It is a lifelong medicine to take for someone's hair. About 9% increase in hair follicle count after a year and 24% in 4 years. In fact, after my taking finasteride for 4 years, my sister-in-law said, I have to confess, your hair is actually thicker. And also I noticed my scalp wasn't burning in the sun anymore. There is an over-the-counter medicine called Rogaine or Minoxidil, and the 5% foam has been shown to be about 30% effective, and the foam is less irritating than the solution. I heard there's actually a combo solution now of finasteride and minoxidil, but I don't have any studies on this yet. Do shampoos work? Not one shampoo has been shown to treat male pattern baldness. If a person has a fungal infection on their scalp that's causing hair loss, then certain shampoos can help that, but that's not treating male pattern baldness. Now here's a tongue twister: low-level light laser therapy. This is the newest, hottest thing, and after 26 weeks, studies have shown there's a significant increase in hair growth, but we don't know yet quite how to dose this. And lastly, there's a hair transplant. Since hair tends not to fall out on the back of the head, they can transfer the hair to the front. I have my own opinion about this, but I'm not going to share that with you today. I'm Dr. John Hong. Thanks for tuning in.